Have you just delivered and you're wondering, how do I actually keep an eye on my caesarean section scar? How do I look after the wound? You're not alone. Lots of people that I see through the maternity triage struggle with their wound. And in this video, I'm here to talk to you about just that. I'm Remi, I'm obstetrics and gynecology with over 10 years of experience within the NHS. And I routinely work in a maternity triage, which is a space that women can attend from 18 weeks of pregnancy right through to about 4 weeks after delivery if they have any issues or complaints. And in this video, I'm going to share a story, not based on any one patient, but based on my years of experience to really hammer home what it's like to have an infection, what happens when you attend a department, and what treatment is available for you. This is for educational purposes only. This is not medical advice. But if any of this resonates, please seek advice from your clinician about what to do next. Let's talk about Joanna. She's a lady that had a caesarean section just under 2 weeks ago, and she comes into the maternity triage. She's tired and she's had, unfortunately, a long wait, which can happen, but that's not to put you off going. She comes in because the midwife in the community said, your wound needs to be looked at by a doctor. And I'm that doctor. She comes along with a trusted family member, and I ask her into the cubicle and I just ask a normal, general, open question, why are you here today? And her response is, the midwife sent me in. She said, thinks there's something wrong with my scar. And I would routinely say, have you had a look at it? What do you think about the scar? And on this particular occasion, Joanna's a bit flustered. She's like, no, I've not had a chance. Maybe she's got babies at home. Maybe this is her first baby and she's struggling to cope. So the next questions that I would then want to know is, have you noticed any abnormal smells, any discharge? Is it causing you more pain than you would expect? Typically at the time of discharge, you would be told, keep the dressing on for a certain number of days. And when you take it off, you want to make sure that the wound is nice and dry. And these are the type of questions that, again, I would ask Joanna. Have you been washing it? Have you put soaps on it? Have you put oils? No. So I ask permission to examine. And as Joanna lifts up her top, the first thing that I notice is the smell. Now, this is not to make anyone feel bad or put anyone off, but working in maternity care, in gynecology, I know when something smells infected. And it's a really hard smell to get across. But it's almost like a sickly sweet, pungent smell. And that's the first thing I can smell once Joanna exposes the wound. I then go a bit closer and have a look at the wound. So I'm not even touching the wound at this point. And I can see across the incision, the skin around it is discolored. In women who have fairer skin, you would expect it to be red. In women with darker skin, you might see a discoloration and definitely a change in what you would call their normal skin. And as well as this, I can see gaping. So that again is where the cut's been made and the stitches have been done, but now there's an opening up of the stitches. And this could range from being open just by a bit or a lot. And this is something that I've seen definitely over the years. And when you see the gaping, more or less, you will then see coming from that discharge. And it could be yellow, it could be pink, it could be watery, it could be a lot. The amount of discharge is often related to how bad the infection is. So again, recap, Joanna, she's had a caesarean section less than 2 weeks ago. She's got smells coming from the wound. There's a gaping of about 1 centimetre, and I can see pinky yellow discharge coming from the wound. Now, unfortunately, Joanna can't see this because where is the wound? Just at the bottom of her tummy. And depending on your size, depending on how the tummy hangs or overhangs, it can be really awkward to see. So what I've said to Joanna is, look, give me your phone. And also got her family member involved as well, because they're your support system. Bring your phone, and I put it in selfie mode. And I'm like, can you see this scar? This is what the infection looks like. And so Joanna is now empowered. She knows what the scar looks like. Her family member is also aware of what the scar would look like. And I say, look, take a picture of it today because we now need to know what it will look like over the next week. So now you might be thinking, okay, so she's got an infection, but what do you do next? The thing to do next is to treat it. And the treatment for it really depends on how bad the infection is. So Does Joanna show signs of having an infection that's gone into the bloodstream? And the way that we can do that is by checking her temperature, her heart rate, but also taking some bloods and looking for her infection markers on there. Does it look bad enough that I'm worried that taking tablet antibiotics won't be enough to treat it? Does she need to come in for antibiotics through a drip? Or am I concerned enough that the area around the scar or the wound isn't going to heal and therefore needs to be debrided? So going back to theatre to remove parts of the infected tissue and start all over again. So in Joanna's situation, it was deemed on my clinical impression that it was safe enough to treat her with antibiotics and send her home. But only with the caveat that she keep an eye on the wound, she report back if she feels it's getting worse and not better within 48 hours, and that I was going to book her an appointment for us to have another look at the wound just to make sure that everything was okay. In addition to that, I'm going to give her some simple techniques about how to look after the wound now that it's infected. So what bacteria and bugs and all of those things really love is a wet, warm environment. And so when you've had a caesarean section, you often will have a dressing over the wound, and depending on the type of dressing, so some dressings can come off within 24 hours, some work best by being on for 5 days or 7 days, and definitely check with the surgeon who's done the operation. But when the dressing comes off, the advice is typically have a shower, don't have a bath. And then once you have a shower, you want to make sure that the wound is really dried afterwards. So you're patting it dry, not rubbing at it, not adding friction, not making it irritated. And then a trick that I often will share with my clients or patients is like when you're home and you're feeding the baby whichever way you want to, or you're getting a bit of rest, lay flat and expose the wound so that it gets lots of air, because the air will cause it to dry up and make it a really uninhabitable space for the bacteria to linger. And by doing those things, you can really help promote the healing of the wound, especially after an infection. What you don't want to be doing in those early days is putting creams or oils or getting aggressive massages or wearing underwear where it chafes on the wound. By all means, wear underwear that protects it, but expose it to the air often. That's the type of advice I'd give Joanna. And that's typically the type of advice I'd give any woman after they've had a caesarean about what to do next once they get home. So bearing those things in mind, an infection on the wound is not always preventable, and we do lots of interventions in hospital to try and reduce the amount of infections on a caesarean section wound, on a perineal wound. So it's not always preventable, but doing some of those steps that I've mentioned before can prove beneficial in reducing maybe the severity or the likelihood of you getting an infection. So that's making sure that it's nice and dry, not putting any sort of irritants on it. When you're having a shower, once you come out, pat it dry, exposing it to the air frequently. In some women who have a higher BMI, we're really concerned for infection. They might have a different type of dressing, a vacuum dressing, and that's to help extract all the liquid from the wound, keep it nice and dry, and reduce the likelihood of infections being there. So I hope that you've really understood the importance of checking your wound, keeping it clean, and if you notice anything like pain, abnormal discharge, gaping of the womb, you notice that your underwear is getting stained really from the wound, or it feels hard and lumpy and it doesn't feel like it's getting better, those can be signs of infections. And those are the type of things that we would want to get checked out in hospital. So once you've had a baby and you're at home, as well as looking after yourself, looking after the baby, it is important that you are checking on your wound to make sure that your recovery is as smooth as possible. And if there is anything untoward, that you seek help sooner. Let me know in the comments below, have you ever had an infection in the wound? How did you manage it? How did you feel it was managed? And how did it affect the rest of your postnatal recovery? Like I said, on this channel, I'm producing content for women after delivery. Subscribe to Her Health Room, where I will be releasing videos about all aspects of postnatal recovery, physical recovery, emotional recovery, and social recovery. If you have any particular videos that you would like to see, leave a comment for me down below. Engage with this channel. You can find me on Instagram and on TikTok, and I look forward to seeing you in my next video.